This week's Ask Dr. Durie is quite a common treatment-related question. The questioner asks, after my myeloma relapsed, I was started on Revlimid and Dex treatment, which has really worked very well. After 1 year, my numbers are still continuing to respond, so how should I handle the details of my treatment moving forward? Well, this is something that's quite important to work out in terms of planning. Now, we don't want to answer this sort of question in this format because what I say for one patient may not directly apply to another patient. And so what I'm going to say is a broad answer as to how to consider ongoing treatment in this setting. So if Revlimid and Dex, low Rev Dex, as we call it, is working well, it is important to continue the combination of both drugs as long as you're seeing benefit. If the IgG or IgA or urine protein are coming down, it's important to get that maximum benefit. And so Revlimid and Dex should be considered on an ongoing basis, even beyond 1 year. However, it is important to make adjustments over time. As the numbers stabilize and maybe if the spike disappears, it may be possible to think about reducing the dose of the dexamethasone, even down to 8 milligrams or 4 milligrams, and ultimately to think about even stopping the dexamethasone so that one can avoid what are significant cumulative side effects of the dexamethasone. And so this is only recommended if the disease is continuing to be in remission and everything is looking good in terms of the other testing. And then, over time, it may be possible to even reduce the dose of the Revlimid. Taking Revlimid on an ongoing basis can reduce the blood counts, and there can be other side effects. And so the Revlimid may need to be reduced to 10 milligrams instead of 25 milligrams, or even down to 5 milligrams, which can be a useful ongoing dose. And so the bottom line in this situation is that it is important and frequently extremely helpful to stay on the Revlimid and the dexamethasone for as long as it's working well. However, dose adjustments may be required, including stopping the dexamethasone and dose reduction of the Revlimid. But ongoing therapy frequently extremely helpful for such a patient.